Imagine walking into a clinic. You feel fine, just a little tired lately. The doctor looks at your reports, pauses, and says, "You have metabolic syndrome." And that's when everything connects. Most people don't even know this diagnosis exists. But it sits right at the edge, the stage just before diabetes, just before heart disease. And today, in the next few minutes, you'll know whether you already meet the criteria. Let's get into it. Metabolic syndrome is one of those terms that gets thrown around in clinical settings without anyone really stopping to explain what it means. And that gap in understanding is quietly dangerous. Most people hear it and assume it's a single condition, something you either have or you don't, like a broken bone or a bacterial infection. But that's not what it is at all. Metabolic syndrome is a cluster, a convergence. It's the medical world's way of saying that several different warning signals have appeared in your body at the same time, and together they paint a picture that demands attention. To be formally diagnosed, a doctor needs to see at least 3 out of 5 specific markers present in the same person. Not 4, not all 5, just 3. And that threshold matters, because it means you could be walking around with 2 of these markers right now, feeling completely normal, with no idea how close you are to the line. That's not a hypothetical. That's the reality for tens of millions of people who have never had this conversation with their doctor, or who had it briefly and walked away without truly understanding what was being said. So what are the 5 markers? The first is a large waist circumference, more than 40 inches for men, more than 35 for women. And this isn't simply about being overweight in a general sense. And this is specifically about fat that accumulates deep in the abdominal cavity, surrounding the organs. That distinction matters because visceral fat, the kind you can't always see or feel on the surface, is metabolically active in a way that subcutaneous fat simply isn't. It releases inflammatory signals, it interferes with hormonal regulation, it doesn't just sit there passively, it participates in pushing the body further out of balance. The second marker is elevated blood pressure, specifically 130/85 or higher, or being on blood pressure medication regardless of your current readings. Blood pressure at this level often produces no symptoms whatsoever. You don't feel it. Your head doesn't hurt. You're not dizzy. The pressure is just quietly straining the lining of your arteries, making them less elastic over time, increasing the workload on your heart with every single beat, day after day, year after year. The third marker is elevated fasting glucose, a blood sugar reading of 100 milligrams per deciliter or above after not eating for at least 8 hours. This is the pre-diabetic range. It's not diabetes yet, but it's the body signaling that its ability to manage blood sugar is starting to degrade. Insulin is being produced, but the cells aren't responding to it as efficiently as they should. The door to type 2 diabetes isn't open yet, but it's no longer fully closed either. The fourth marker is high triglycerides, 150 milligrams per deciliter or more in the bloodstream. Triglycerides are fats that circulate in the blood, and they rise when the body is dealing with more sugar and refined carbohydrates than it can efficiently process. The liver converts that excess into triglycerides and releases them into circulation. High levels are closely tied to insulin resistance and are a reliable indicator that the body's energy management system is under significant stress. And the fifth marker is low, HDL cholesterol, the kind commonly referred to as good cholesterol, below 40 for men, below 50 for women. HDL functions like a cleanup crew for the cardiovascular system, helping to carry harmful cholesterol away from artery walls and back to the liver for processing. When HDL falls too low, that protective mechanism weakens, and the risk of arterial buildup increases substantially. Now here is where it becomes important to sit with this for a moment. Each of these 5 markers in isolation might seem manageable. A slightly high blood pressure reading gets monitored. A fasting glucose in the pre-diabetic range prompts a conversation about diet. A large waist measurement leads to a general recommendation to exercise more. Individually, none of them feel like emergencies. And that's exactly the problem. Because the danger of metabolic syndrome isn't in any single marker. The danger is in the combination. In the way these 5 signals reinforce and accelerate one another, in the way the presence of 3 of them simultaneously tells a very different story than any one of them ever could alone. And in the fact that most people never connect the dots, because no one has ever laid out all 5 in front of them and said, "Look at these together. This is what they mean when they appear at the same time. This is what your body is trying to tell you before it runs out of time to tell you anything at." Metabolic syndrome rarely appears out of nowhere. It doesn't arrive suddenly one morning because of a bad week of eating or a few missed workouts. It builds slowly, methodically, through a chain of events that begins years, sometimes decades, before any doctor circles anything on a lab report. And when you trace that chain back to its origin, you almost always end up at the same place. Insulin resistance. One root cause, quietly setting everything else in motion. To understand why insulin resistance matters so deeply, you have to understand what insulin is actually doing in a healthy body. Every time you eat something that raises blood sugar, bread, rice, fruit, anything with carbohydrates, your pancreas responds by releasing insulin into the bloodstream. Insulin's job is to act like a key, unlocking the doors of your cells so that glucose can enter and be used for energy. In a healthy, sensitive system, this happens efficiently. Blood sugar rises. The insulin is released. Cells open up. Glucose enters. Blood sugar comes back down. Clean, controlled, balanced. But when cells are exposed to chronically elevated insulin over a long period of time, which happens when someone eats a diet consistently high in refined carbohydrates and sugar, lives with ongoing stress, doesn't move enough, or doesn't sleep well, those cells begin to adapt. They become less responsive. The key still fits the lock, but the lock has grown stiff. And the pancreas senses that blood sugar isn't dropping the way it should, so it does the only thing it knows how to do. It produces more insulin, trying to force the response it's not getting. And for a while, this works. Blood sugar stays controlled. But the cost is chronically elevated insulin levels circulating through the body at all times, and that cost is enormous. High circulating insulin is one of the most powerful fat storage signals the human body knows. It directly suppresses the breakdown of stored fat and actively promotes the conversion of excess glucose into fat, particularly the visceral kind that accumulates deep in the abdominal cavity. So the waistline grows, and that growing visceral fat isn't passive. It begins releasing a steady stream of inflammatory cytokines, signaling molecules that travel through the bloodstream and begin causing damage to tissues far beyond the belly itself. Those inflammatory signals reach the blood vessel walls and begin irritating them, causing the vessels to narrow and stiffen. The heart has to push harder to move blood through a more resistant system. Blood pressure climbs, and as insulin resistance deepens, the liver, which is trying to manage the overflow of glucose it keeps receiving, begins converting more and more of that excess into triglycerides, packaging them up and releasing them into the bloodstream. Triglyceride levels rise. And as they do, HDL cholesterol, the protective cleanup cholesterol, gets displaced and suppressed, falling to levels where it can no longer adequately protect the arterial walls from damage. So, look at what has happened. One broken process, cells failing to respond properly to insulin, has now produced a large waste, elevated blood pressure, rising fasting glucose, high triglycerides, and low HDL. All 5 markers of metabolic syndrome. Not 5 separate problems that coincidentally appeared together, but 5 visible expressions of a single underlying dysfunction playing out across different systems simultaneously. This is why treating each marker in isolation so often fails to address the real problem. Medicating blood pressure without resolving insulin resistance leaves the inflammation untouched. Lowering triglycerides with a statin without fixing the dietary patterns that drove insulin resistance in the first place leaves the root cause intact and still generating damage. The markers are not the disease. They are the symptoms of the disease, and the disease is metabolic dysfunction that started long before any of them became measurable enough to show up on a standard blood panel. Understanding this changes everything about how you approach the problem. It shifts the question from how do I lower my blood pressure or how do I bring my triglycerides down to something far more fundamental. What is causing my cells to resist insulin, and what would it take to restore their sensitivity? Because if that question gets answered honestly and acted on consistently, the 5 markers don't need to be addressed one by. There is something uniquely dangerous about a condition that causes serious, progressive harm while producing almost no symptoms that feel serious enough to act on. Most diseases give you a signal you can't ignore, pain that stops you in your tracks, a fever that puts you in bed, a symptom that makes the decision to seek help feel urgent and obvious. Metabolic syndrome doesn't work that way. It operates almost entirely beneath the threshold of what most people would call feeling unwell. And that silence is not a sign that nothing is happening. It's the most dangerous thing about it. Think about what the 5 markers actually feel like from the inside. A waist that has grown gradually over several years doesn't feel like a medical emergency. It feels like life, like aging, like the natural consequence of a busy schedule and less time to exercise. Slightly elevated blood pressure at 130/85 produces no headache, no dizziness, no chest tightness in most people. And it simply exists, invisibly, pressing against arterial walls with every heartbeat while the person carrying it goes about their day feeling essentially normal. A fasting glucose of 105 doesn't announce itself. There's no pain, no visible change, no moment where the body says, something is shifting here, pay attention. Triglycerides at 160 are completely silent. Low HDL has no sensation attached to it whatsoever. You cannot feel your good cholesterol being low. But you cannot feel your protective mechanisms weakening, and so people don't feel sick. They feel tired, but tiredness is easy to explain away. A demanding job, a poor night of sleep, the general weight of adult responsibilities. They might notice that they're carrying more weight around the middle than they used to, but that too gets folded into a broader narrative about getting older, about metabolism slowing down, about things that are simply expected to change with time. And the story they tell themselves is entirely believable, because nothing contradicts it forcefully enough to demand a different interpretation. This is exactly how years pass. Not through negligence or carelessness necessarily, but through the simple absence of a signal strong enough to interrupt a normal life. And while life continues normally on the surface, the trajectory beneath it is being written with remarkable consistency. The insulin resistance deepens. The inflammation becomes more chronic. The arterial walls accumulate more damage. The pancreas works harder to compensate for cells that are growing less and less responsive. Each year that passes without intervention doesn't just maintain the problem, it compounds it, moving the body further along a path that becomes progressively more difficult to reverse the longer it continues. What makes this particularly sobering is that by the time most people receive the metabolic syndrome diagnosis, they have often already been living with multiple markers for 3, 4, sometimes 5 or more years without knowing it. The diagnosis doesn't mark the beginning of the problem. It marks the moment the problem became visible enough to be measured and named. The actual deterioration began long before the appointment, long before the blood panel, long before anyone used the words metabolic syndrome in a clinical context. This is why the silence is the danger. Not because the condition is impossible to detect, it isn't. A standard set of blood tests and a tape measure are all it takes. But because the absence of suffering makes it easy to postpone the conversation, to assume that feeling fine means being fine, to treat the absence of obvious symptoms as permission to wait, and the condition never argues with that decision. It simply continues, quietly, precisely, doing what it has always been doing, unbothered by the fact that the person carrying it hasn't yet recognized what is already well, The most important thing to understand about metabolic syndrome, the thing that changes the entire emotional weight of the diagnosis, is that it is not a permanent sentence. It is not a threshold you cross and cannot return from. It is not the body announcing that the damage is done and the trajectory is fixed. It is, at its core, a collection of measurable markers that responded to certain conditions to get worse, which means they can respond to different conditions to get better. And the biology works in both directions, and that is not a motivational statement. It is a physiological fact supported by decades of clinical research. The reversal doesn't require an extreme intervention. It doesn't require perfection or a complete overnight transformation of every habit or pharmaceutical assistance in most cases. Research consistently shows that losing just 7 to 10% of total body weight produces significant, immeasurable improvements across multiple markers simultaneously, not 30%, not half your body weight, 7 to 10. For someone weighing 200 pounds, that's 14 to 20 pounds, a target that is genuinely achievable through sustainable changes rather than punishing restriction. At that level of weight loss, blood pressure drops, fasting glucose improves, triglycerides fall, and HDL begins to rise, often within weeks of the weight loss beginning rather than months. Though strength training 3 times per week attacks the problem at its metabolic root. Muscle tissue is the body's primary site for glucose disposal. When you contract a muscle repeatedly under load, it pulls glucose out of the bloodstream directly, independent of insulin, through mechanisms that remain active for hours after the session ends. Building and maintaining muscle mass means building a larger, more efficient system for clearing blood sugar, which directly addresses the insulin resistance that started the entire cascade in the first place. This is why strength training produces metabolic benefits that go far beyond what the scale shows or what cardiovascular exercise alone can achieve. Sleep, approached with the seriousness it deserves, functions as a genuine metabolic intervention. Chronic sleep deprivation, consistently getting under 6 hours, elevates cortisol, and impairs insulin sensitivity, disrupts the hormones that regulate hunger and satiety, and actively promotes the storage of visceral fat. Extending sleep to 7 or 8 hours consistently removes a significant source of physiological stress that was quietly worsening every marker in the cluster. Reducing processed carbohydrates lowers the chronic glucose and insulin load that drove the dysfunction forward, then giving the pancreas room to recover and allowing cells to gradually restore their sensitivity. And managing psychological stress removes the cortisol-driven signal that specifically redirects fat storage to the abdomen, the very fat that sits at the center of the cluster both literally and metabolically. None of these pillars require achieving them perfectly or simultaneously. Each one produces independent benefits. That together they create a compounding effect where the body's systems begin supporting one another's recovery rather than compounding one another's dysfunction, and the cluster that took years to build begins. There is a particular kind of clarity that comes from receiving information you didn't know you needed. Most people walk into a routine appointment expecting confirmation that everything is fine, that the numbers are normal, that they can continue on the path they're already on. And when a doctor instead points to a lab report and begins explaining that 3 out of 5 markers are present, that this cluster has a name, and that this name carries real implications, the instinct is often to receive that as bad news, as a verdict, as the body having already failed in some fundamental way that cannot be undone. But that interpretation, as understandable as it is, gets the situation exactly backwards. A metabolic syndrome diagnosis caught early is not the body failing. It is the body succeeding at the one thing it is designed to do above almost everything else: communicate. The human body is an extraordinary signaling system. It is constantly generating information about its internal state, constantly adjusting, constantly attempting to restore balance, and constantly sending messages through every channel available to it about what is working and what is not. Most of those messages go unread. Most of the early signals are too quiet, too easy to rationalize, too simple to attribute to something else. Fatigue becomes a busy schedule. A growing waistline becomes aging. Slightly elevated numbers on a blood panel become something to watch rather than something to act on. Metabolic syndrome, when it is identified, represents one of those rare moments when the body's communication becomes clear enough to be measured, named, and acted upon before the window for meaningful intervention has closed. That is genuinely rare. Many of the conditions that follow metabolic syndrome, type 2 diabetes, cardiovascular disease, and arterial damage that has progressed beyond reversibility, do not offer the same clarity at the same stage. They announce themselves later, when the options have narrowed, when the damage has compounded to the point where management rather than reversal becomes the realistic goal. Metabolic syndrome arrives before that point. It arrives while the system is strained but not broken, while the markers are elevated but not yet entrenched, while the body is asking for a correction rather than demanding damage control. This is what makes the early diagnosis not just tolerable, but genuinely valuable. More valuable in a real sense than a clean bill of health given to someone who is 2 years away from the same diagnosis, but hasn't yet crossed the threshold where the numbers become visible. The person who receives the metabolic syndrome diagnosis today has something the person with slightly better numbers does not. They have a specific, measurable, actionable picture of exactly where their body stands and exactly what it needs. The path forward is not obscure. The markers that indicate the problem are the same markers that will confirm the recovery. Progress is trackable. Improvement is visible. The body that was communicating dysfunction will communicate restoration just as clearly through the same channels in response to the same